Hello everyone. Welcome back to the Medicare Space channel. My name is Victoria Cabrera, Medicare insurance agent here in San Antonio, Texas. But I help everybody across the nation try to understand Medicare and bring a little bit less stress to all of the parts of Medicare and how everything works. So again, if you watched the previous videos or if you haven't, please go back and watch from the beginning, or you can just pick the videos that you want to see that apply to you. And today, one more thing, please do me a favor, please do me a favor and go ahead and hit that subscribe button down there. It's that red button. You'll know when you've subscribed because it'll gray out. Thank you so much for that. So today we are going to be talking about Part C of Medicare. And what is Part C? So Part C of Medicare is also known as Medicare Advantage. So a lot of you guys hear everywhere about Medicare Advantage, Part C, Medicare supplements. You hear all this stuff and you might get mixed up. You might think that Medicare supplements are a Medicare Advantage plan, or you might think Part C is a Medicare supplement. So I'm going to help you understand what Part C is and whether or not you need it. Okay. So today, again, Part C is also known as Medicare Advantage. They're federally regulated programs offered by private insurance companies. So what it is, it combines the Part A, it combines the Part B, and it also includes drug coverage in most cases, not every case, but in some cases, it'll include drug coverage. So you'll see the difference between MA, which is a Medicare Advantage plan without drug coverage, and MAPD, which is a Medicare Advantage with drug coverage. And they're offered by several different insurance companies. It's going to be based on the service area you live in. So keep in mind, if you are in an area where there are no Medicare Advantage plans, then you would not be able to enroll into a Medicare Advantage plan. Typically, in most areas, there are Medicare Advantage plans available. And you may even live in a service area where there's like 30 Medicare Advantage plans available. So again, it's always based on your service area. So it's very important, if you're moving from one county to another, you want to make sure that you're in the right plan at all times. Okay. Now, who qualifies for Medicare Advantage plan? A Medicare Advantage plan, you would have to be enrolled in both Medicare Part A and Part B. So if you do not have Medicare, you cannot unfortunately have a Medicare Advantage plan. If you do have Medicare, but you're only on Part A or you're only on Part B, you cannot get a Medicare Advantage plan. You would have to have both Part A and Part B. Okay. A lot of people get this mixed up because they think just because they have that red, white, and blue card that they can pick up any plan they want, and that's not true. Okay, for this particular situation, you have to have Part A and Part B. Now, a Medicare Advantage plan, if you do have Part A and Part B and you want to pick up a Medicare Advantage plan, it's very important that you understand the differences of the types of Medicare Advantage plans there are. I'm only going to go over two. The main one is an HMO and a PPO. An HMO is a health maintenance organization, and it's just a fancy word or word for saying you have to stay within a network of providers. So both of these types of plans, HMO and PPO, and all Medicare Advantage plans are network-based plans. So what that means is you usually have to stay within a network of providers in order to receive care within that plan. A lot of people will say, well, Victoria, can I still use this red, white, and blue card? And the short answer is no. You don't lose Medicare. Okay, you have to have it in order to have Medicare Advantage. But what happens is your Medicare Advantage now becomes primary, and some will even use the word a replacement to original Medicare. But I always look at it as primary health insurance. You always want to put that card away And this is going to be your one card for everything. It's going to be the card that you give to the doctor. It's going to be the card that you give to your specialist. And it's going to be the card that you give to where you pick up your drugs at the pharmacy. So yes, I don't like to say that you lose the Medicare, but it is, Medicare Advantage is a replacement to original Medicare where your particular plan becomes primary. Now, if you choose a Medicare Advantage plan, I always like to compare it to if you've ever had insurance through an employer or through a group insurance plan. Maybe your spouse was working and you received insurance through your spouse's insurance coverage, or maybe you worked at a company for 50 years and you've always had group insurance company with one card for everything. That's exactly how Medicare Advantage works. Now, Medicare Advantage will cover everything that Medicare covers. However, they're typically covered at a fixed rate. So where there's co-pays, co-insurance. Co-pays is a fixed dollar amount and co-insurance is a percentage of the medical cost. So it just depends on your plan. You really want to look at the details of each plan to understand how each service is covered. And we help you with that kind of thing. So if you do need help and you're confused, we'll definitely help you understand these plans. Now, again, where do you get it, right? Where do you get these plans? Well, again, the best way is to either one, meet with an agent so that way they can help you pull up all the plans, or two, another way, you can go to medicare.gov and it'll pull up all the plans in your service area. Now, when you do it this way, it gets very confusing because if you're not internet savvy, then it could be very overwhelming. If you are internet savvy, it's actually pretty simple. You just type in your zip code, you answer a few questions, and it'll pull up all the plans in your area. So it'll pull up all the plans, but it doesn't mean that all these plans might be the best fit for you. It's going to really be an easy way of I like to put it, process of elimination, right? It's going to be based on your primary care doctors, the prescriptions you're taking, and your budget. It really depends on a few things. But let's go back, let's rewind a little bit, okay? Going back to HMO and PPO, the difference. An HMO is a health maintenance organization, and basically there's only in-network benefits. So what that means is you have to stay within the network of providers and facilities within that plan in order to be able to use the insurance. And there are referrals required. So in this particular situation, you're assigned a primary care doctor, and that primary care doctor, if you do need to see a specialist, they do have to give you the referral. Okay. On a PPO plan, the benefits is, you have a little bit more flexibility. There are no referrals required. You have in and out of network benefits, and you do on the PPOs, there's just more flexibility. Now with the PPO, the pros and the cons, right, is with an HMO, you heard that you have to have a primary care doctor. They have to give you the referral, and you have to stay within a network of providers. But these types of plans are normally more rich in benefit. They give you extra benefits that original Medicare doesn't give you. The copays might be very low. In some cases, you might be able to get an HMO plan with no plan cost. On a PPO, there might be an additional premium involved, and the copays typically are a bit higher. And then when it comes to extra benefits, those extra benefits are not as rich as on an HMO. Now, understand with both of these plans, you have to continue to pay your Part B premium. Again, on both of these types of plans, or any plan for that matter, you have to continue to pay your Part B premium. I can't stress that enough. A lot of people will come to me saying, my agent said that this plan wasn't going to cost me anything per month. I knew it was too good to be true because they're still taking $144 out of my Social Security check. Well, the answer to that is that you have to continue to pay that Part B premium. Because remember, like I said before, you have to have Part A and you have to have Part B in order to pick up a Medicare Advantage plan. So when can you get a Medicare Advantage plan? A Medicare Advantage plan can be picked up 3 months before or 3 months after your initial enrollment period. So basically, let's just use the example, you're 65, correct? So let's just say you turned 65 on March 1st. Well, you would have had a 3-month window to pick up a Medicare Advantage plan prior to your 65th birthday and 3 months after. And what that means is let's just say you were to be enrolled in a Medicare Advantage plan 3 months before your Medicare became effective. Just because you can submit your application and enroll into a plan, that does not mean that your plan is effective. It's going to be effective when your Part A and B is effective, or when your Part B is effective. So again, it doesn't necessarily mean that they're going to give you coverage at that day. Or same thing, if you turned 65 in March and you kind of waited and you didn't enroll until May, they're not going to retro date it from March 1st. It's going to be that effective date that you pick up coverage. So I just want to make that clear. There's a lot of talk is, why do I need it? How do I choose a plan? I am going to make a separate video on how to choose a plan that is right for you. I do also want to make a comment that a Medicare supplement is not a Medicare Advantage plan. Those are two different types. And again, I am going to make a video regarding how to choose and whether or not a Medicare supplement would be the best fit, or whether a Medicare Advantage plan will be a best fit. So again, do me a favor, click on that subscribe button so that way you get these videos every single week, so that way you understand very clearly what plan is right for you. So I just wanted to provide you some basic information on a Medicare Advantage plan. Again, the main points, it is not a Medigap or Medicare supplement policy, okay? You have to have Part A and Part B in order to get a Medicare Advantage plan. And then depending on your situation, and your service area, we'll have to see what Medicare Advantage plans are in your area so we can try to help you make the best recommendation possible. Again, my name is Victoria Cabrera, Medicare insurance agent here in Texas with the Medicare Space channel. If there's any questions, please comment, email me, call me, text me. I'll be happy to help you with any of your questions, and we'll see you on the next video. Thank you so much.